Your timer starts now.
Hello, Mr. Ahmed.
Hello, doctor.
I am Dr. Hafsa with you. What can I do for you today?
Doctor, actually, the nurse said that my heart was beating faster, even though I feel fine.
Can you tell me more?
Yes, doctor. Occasionally, I have this. Uh, Doctor Hafsa, there is background noises from your side.
1 minute.
Hello.
Okay, Dr. Musarat.
Okay.
Hello?
Okay, your
Now
time
it's
is.
clear?
Yeah. Now it's clear. Uh, okay, start again. Doctor, I feel generally
Hello, Mr.
like I'm mostly tired, and I feel mild breathless when I'm working.
Okay. So, Mr. Ahmed, can you tell me since how long you feel this way?
Doctor, on and off, otherwise, not long ago. It's been going on for a few years, you can say, few months.
For since few months.
Hmm.
Have you seen any doctor for this?
No, doctor, I just feel generally tired.
Mhm. And apart from this heart racing, you said you're having chest shortness of breath. Is this all the time? This heart racing all the time?
No, doctor,
Mm-hmm. It comes and goes.
I don't feel heart racing at all. It's just the nurse told me that I have heart racing right now.
Mhm. So the nurse see you. So did she do an ECG for you?
Yes, doctor, she did an ECG. I pause a timer sending you the ECG.
Okay.
Okay, time starts again. Okay, Dr. Hafsa, continue.
Okay, Mr. Ahmed. I have seen the ECG, but can you please tell me at this moment, do you have any short of breath,
No, doctor.
any chest pain?
No, doctor.
Would you like to lie down on the couch?
No, doctor, I'm comfortable.
Okay. Do you feel dizziness?
No, doctor.
Any cough?
No, doctor.
Chest pain?
No, doctor.
Any sudden weakness in any part of your body?
No, doctor.
Okay. So can you tell me this is when was last time you were feeling the this heart this complaint? When was the last time?
Doctor, when I'm doing something.
So with exertion it is?
Yes, doctor.
Okay. Do you have any medical conditions before?
I have high blood pressures and sugars.
And what do you do for that?
I'm taking amlodipine, metformin, and simvastatin.
And is that control your blood sugar?
I didn't go for a checkup in a while.
Okay, no problem. I'll see. Beside this, do you are you taking any other medications?
No, doctor.
Do you have family history of heart disease?
No, doctor.
Do you smoke?
No, doctor.
Do you drink alcohol?
Yes, doctor. Mostly small whiskey most evenings.
How much do you drink?
Almost one glass in one sitting.
Every day?
Yes.
Okay. And how about your diet in general?
Look, I'm trying to take good and healthy diet, but sometimes I get junk food and some
Mm-hmm.
sugary fruits also. Yeah,
Mm-hmm. And do you know your body weight according to your height?
26.
26. Um, do you do exercises?
No, doctor.
And may I know why?
Doctor, I just I'm fine and don't do a lot of exercises. Sometimes I walk,
Mm-hmm. Okay. And with whom do you live?
live with my wife and
Mm-hmm.
one son.
Mm-hmm. And what do you do for living?
Doctor, I stay at home. I'm doing nothing right now.
You're staying at home.
Yes,
Ah, okay. And how is your sleep?
my sleep is fine also.
How is your mood?
My mood is good.
Okay, that's good to hear. Do you have any blurry visions?
No, doctor.
Any pain in your joints?
No, doctor.
Okay. Is that okay if I examine you?
Sure, doctor.
So after proper sanitization and presence of chaperone and privacy, I would like to check your blood pressure, pulse, temperature, oxygen saturation, respiratory rate, eyes for pallor and jaundice, also lymph nodes palpation, and chest examination. I would like to check. Can you please open up your shirt so that I would like to do inspection, palpation, auscultation for areas of the heart, along with auscultation for 6 areas of the lung from the front and back. And also, I would like to check for JBP if it is raised or not, and then peripheral edema.
Okay. BP 138 by 76. Pulse irregular 92. Otherwise, no, normal on ECG, it shows atrial fibrillation.
Okay. So, Mr. Ahmed, what do you think is going on with you?
Doctor, I think it's kind of a heart problem. Maybe irregular heartbeat.
Mm-hmm. And what makes you worry the most?
Doctor, I'm concerned it could cause my heart to fail or sudden death.
Mm-hmm. And how can I help you?
Doctor, I want some clear explanation and treatment.
Okay. So, Mr. Ahmed, you said that how it is affecting you?
Doctor, I'm worried since I got this ECG.
Okay. So, Mr. Ahmed, let me summarize. You said that you have sudden shortness of breath along with heart racing as the nurse checked your ECG, and you are feeling you are worried that it might be some problem in the heart, and you want me to tell you what is going on with you. Is that all?
Yes, doctor. Yes, doctor.
Okay, so Mr. Ahmed, as per the ECG, it is like atrial fibrillation. Have you heard about that?
No, doctor.
So it's a condition in which the heart does not pump normally. Instead, it vibrates. So it is a kind of abnormal heart rhythm. So for this reason, at this moment you are stable. I am happy that you are stable. But as you told me that you are having shortness of breath and you are feeling fatigue. For that reason, I would like to send you to the heart specialist within 2 weeks. Will that be okay with you?
Okay, doctor.
Okay. And beside that, I would like to do some blood investigations for you as you are having high blood pressure, high blood sugar. So how about if I do some liver function, kidney function, urea electrolytes, EGFR, all these tests? Will that be okay with you?
Sure, doctor.
Any finding?
Pending.
Okay, so Mr. Ahmed, apart from this, your diet was not on a good side. So, is that okay if you can reduce the intake of junk foods and salt and carbohydrates, and instead increase the intake of fruits and vegetables, whole grains? Can you do that?
Okay, doctor. I will try.
Yeah, that's good. And beside that, also you need to do some exercises as exercise is very important, at least 30 minutes brisk walk every day, if it is possible for you.
Okay, doctor.
And beside that, as you said that you are drinking alcohol, Mr. Ahmed, it can affect your heart. So is that okay
Cancer.
if you can stop it? Oh, I did not
Okay,
finish.
doctor.
Okay,
Time's up.
so okay, safety netting. I didn't.
Yeah, it's okay. We'll discuss about it. So your next is Mrs. Lena, 58 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Hello, Mrs. Lina. I am Dr. Hafsa with you. What can I do for you today?
Doctor, actually, I went for these lab results and I want to know about them.
Can you tell me more? Can I see the lab results?
Yeah, urine dipstick shows plus 114 two times.
Plus,
Plus one protein two times.
mm-hmm. Any blood investigations or only this one?
Only this.
Okay, Mrs. Lina, can you tell me why did you do this test?
Doctor, I was just getting a normal, regular follow-up, and the nurse did this, and it shows something bad in it. I want to know what's wrong.
Okay, okay. So what complaint you were having so that you have done this test?
It was my regular checkup for this high blood pressures.
Okay, so you are non high blood pressure
Yes,
for how long?
for 10 years now.
And what do you do for that?
I'm taking amlodipine.
Do you take them daily regularly?
Yes, doctor, sometimes I forget.
Mm-hmm. And did you, okay, you forget. And did you check your blood levels recently?
No, doctor.
Okay. So, do you have any blurry vision,
No, doctor.
headache,
No, doctor.
chest pain,
No, doctor.
any frothy urine
No, doctor.
or any blood in the urine?
No, doctor.
Okay. Apart from high blood pressure, do you have any medical conditions?
No, doctor.
Okay. Do you have you noticed any fatigue,
No,
any puffiness in the face?
no, doctor.
When was your last menstrual period?
Doctor was 10, almost 8 to 10 years ago.
Mm-hmm. Okay. So, apart from high blood pressure, any other medical conditions?
No, doctor. Only this.
Any medications?
No, doctor.
Family history of any heart diseases?
No, doctor.
Okay. And what do you smoke?
No, doctor.
Do you drink alcohol?
No.
How about your diet?
I'm taking saltish foods these days.
Salt issues. And what about your BMI, body weight according to your height?
27.
How much?
27.
Hello? 27. And do you do exercises?
No, doctor.
May I know why?
Doctor, I just don't want to do exercise. I stay at home mostly.
Mm-hmm. And with whom do you live?
Live with my husband and one kid.
How things at home?
Everything is fine.
Okay. And what do you do for living?
I I'm doing nothing. I just stay at home.
Mm-hmm. And then how do you do financially?
My husband is taking care of our finances.
Okay, that's good. And how is your mood?
My mood is good.
And how's your sleep?
It's good also.
Is that okay if I so Mrs. What's her name again? I forgot. Uh, what do you think is going
Lena.
on, Mrs. Lena? What do you think is going on with you?
Doctor, I feel like my kidneys are getting bad.
Mm-hmm. And how it is? What makes you worry the most?
I fear dialysis in the future.
Mm-hmm. And how can I help you?
I just want to know if it can be like treated or what can be done for me.
Mm-hmm. And how it's impacting you?
Doctor, I'm just worried. I don't want to die soon.
Okay, I hope it's not. So, Mrs. Lina, let me summarize. You said that you are having high blood pressure for the last few years and you are taking medications, but you are not compliant with that. You are worried that you might be having some kidney problems and you're afraid that you might end with dialysis and you want me to do a treatment for that. Is that all?
Yes, doctor.
Okay. So, is that okay if I examine you?
Sure, doctor.
So after proper sanitization and presence of chaperone and privacy, I would like to check your blood pressure, pulse, temperature, oxygen saturation, respiratory rate, eyes for pallor and jaundice, uh, lymph node, and I would like to listen to your chest, inspection, palpation, and listening for areas of the heart and back and front of the chest. Also, I would like to see for the JVP and also the abdominal examination. Similarly, inspection, palpation, and feeling for ascites and for ballotment for both kidneys, and also the lower limb edema. And also, I would like to check eyes for with ophthalmoscopy in the dark room.
Okay. So blood pressure 152 by 92, otherwise normal, no peripheral edema.
Mm-hmm. Okay, so Mrs. Lina, what you were telling me that you are worried about the kidney. So for that reason, is that okay if I do some blood investigations more for you and kidney
Sure,
function?
doctor.
So I would like to do your CBC, CRP, ESR, fasting blood sugar, lipid panel, EGFR, albumin creatinine ratio, and urea electrolytes, and
Okay.
also the ultrasound of the abdomen.
Okay, it's pending.
Okay, so Mrs. Lina, after I have examined you, what it looks to me that you are having some problem in the kidney as the protein was a bit high and your blood pressure also was high. So I think it's because of your high blood pressure, which is not controlled, as you said that you are taking medications, but you are not taking them regularly. And are you
Hmm.
getting me?
Yes,
Hello?
doctor.
Yeah. So for that
Yes, doctor.
reason, I would like to make a record of blood pressure within 1 week, but after I give you a medication called ACE inhibitors. So do you have any allergy to any medicines before?
No, doctor.
So please make sure to take that medication and this medications. If you are forgetting, can you put a reminder for you to take them daily on the same time so that you automatically remember them?
Sure, doctor.
Okay, so once I see the blood results and all the investigations, I will be in a better position to tell you what we can do for you. Maybe we can refer you for the internal medicine to see you again.
Okay.
Okay, if your EGFR was very less than 30, then we might refer you for nephrologist, otherwise for internal medicine.
Okay, doctor.
Okay, and please make sure that you should not eat a lot of salt and protein. Instead, you can eat a healthy, balanced diet and try to do some exercises, at least 30 minutes brisk walk every day. That will really reduce your blood pressure.
Okay, doctor.
Okay, I would like to see you again after the blood investigations come. And meanwhile, if you have any severe shortness of breath or any swelling, any pain in your abdomen, or if you find that the amount of urine is very less, then please make sure to come again.
Okay, doctor.
Okay, and is there anything else you would like me to clarify?
No, doctor.
Okay, and also I might do Kyow risk score at the end of the consultation to see how much it is
Okay,
with you.
okay, doctor.
Okay, thank you very much.
Thank you, doctor. All right, doctor. Have some 10 seconds remaining. So, first case, atrial fibrillation in an older adult, and second case was hypertensive nephropathy. Okay,
Mm-hmm. Mm-hmm.
hypertensive nephropathy. So, in the first case, you asked for the history, then you went again in the red flags.
Yes, yes, I forgot I should do at once.
Yeah, at once. And those joint pain and other things weren't important. It was just in the starting if you would have asked. Because in
Mm-hmm.
general health, he was completely fine. Only on exertion, he just feel breathless or fatigued. and
No, no,
mild
doctor.
tiredness.
Doctor, I was excluding that if she's because he was 72 years for the fall risk of the fall. That if they have blurry vision or joint pain, just to that.
Yes,
Yeah.
yeah, those red flags are okay to ask, but joint pains, etc., doesn't
Mm,
need. So whatever you ask it before the past medical history, the red flags.
okay.
And you did eyes after the examination also. This is
I
second
forgot
or
it
third time you
actually.
did, yeah?
Yeah, I
Yeah,
forget it. That's why.
yeah. Every time you just finish the psychosocial, come on to the eyes, then
Yes.
examination.
Yes.
And atrial fibrillation here in this case, we will tell the patient that right now you're completely fine, but this irregular heartbeat can form clots in your body that can be dangerous for your health. That's why
Mm-hmm.
here you need to tell the patient about DOACs, especially after calculating the CHAD versus score. I might be starting you on DOACs, okay?
Yeah, yeah, I
After just
was, but it
listening
was
input if
finished.
you want.
Yeah, the time finished
Yeah,
on me. Otherwise, I
yeah.
should.
So
Yeah.
if you start the management plan within 2.5 minutes, you can explain the patient this is basically top chambers are beating irregularly than the others. Okay, and it
Mm-hmm.
can cause blood clots in your body. Right now, you're completely fine, but later on, it can cause damage in your health, etc. And I will be starting you on the blood thinners, dog, after calculating the chart versus score. Okay, and in this case, it was at least four, so it is significant stroke risk. The patient was more than 75, hypertensive and diabetic. So it's definitely we are going to start Rivaroxaban 20 milligram.
So we should start, or the cardiologist has to start.
We can start after the specialist input.
Oh,
Okay,
yeah.
and
And
while you
bit
start on the anticoagulation,
and
tell him that Gigi, yes, Dr. Hafsa saying,
yeah, still we will tell about beta blockers as well.
I'm coming on to that.
Okay.
Okay, anticoagulation. Because in this case, most importantly is anticoagulation. Right now, he doesn't have any symptoms. So just start on the anticoagulation and explain that it can cut about like two-thirds of the risk of having any sudden stroke or sudden death. As he was concerned about it. Okay, so we have to emphasize it. And rate versus rhythm control in this patient, since he's old age, we can start on the rate control, beta blockers, okay? And rhythm control are mostly not started by the primary care physicians. Lifestyle, manage blood pressure, diabetes, and lipids, and otherwise safety netting. And echo is in within 2 weeks. So this was the case, and safety netting you forgot. You
I wanted
couldn't
to add
finish
one thing
actually.
over here. Can you talk?
Yes, doctor.
Yes, doctor. So, doctors, I have gone through extensive research. MRCGP OSCE, International MRCGP UK, they are following plus minus same protocols. Have you seen, doctor, some parameters in different platforms? Uh, there is a ICE asking about the eyes and ask the this is one of the beautiful thing I have seen in MRCGP UK. They're asking the eyes after presenting HOPI rather than they're asking the eyes after psychosocial because many here why I'm talking about here now MRCGP International South Asia, they are a bit advanced than before. They are started digging up the thing. We call it plagiarism or similarity. When you are following the this is what we call it checklist and using some certain sentences that everyone is using. May I know something? May I know something? So this kind of thing they are catching. They are writing on their way, and after that they are doing the research from where this came. Okay, and on the basis of that, they are clear of the things, and they are making the percentage of the exam. I'll tell you guys, please make your own words, make your own parameters. You touch everything. If you're asking ICE after HOPI, this is internationally standardized all over across the world. Whenever you see the OSCE, not I'm talking about MRCGP UK, I'm talking about other parameters also, other exams also. There, after HOPI, if you're asking ICE, there's no harm. Okay. But why many candidates they are losing MRCGP International because of they are using uniform pattern, uniform things means like say copy paste. We are not saying that don't follow those platforms. We are saying that follow the platform, but still you have to follow your own things. It should look your own things, not rather than copy paste from the some either from us, either from any other platform. Okay, so make your own things, make your own parameters, make your own pro forma, make your own everything. Okay, just giving you one example. I am training every day many doctors. She's also training many doctors. We have found out when one very suspicious thing like that one. What we call it one introduction. What is introduction, doctor? Introduction based on your capability, your own thing, how you're opening up with someone. Okay. This is not a hard and fast rule written from the skies. No, this is something standard. How you're going to introduce yourself to the patient. How we are doing in daily practices. Okay. So try to make your own thing. Just like say, I will be giving you example. Many of us asking about, hi, Mrs. Susan, may I know, confirm your name and age, please? Doctor, first of all, you have to understand. Doctor, there is a one paper written over there or pasted over that or cubicle. Their name also written, their gender also written, their age also written, and purpose also written. Purpose in a sense that there is some hint given to you. So how we are going to ask this thing? This is pretty unsure because if it is not written over there, then I can ask patient about identity, ask about other things. Okay, here examiner wanted to see how you are introducing yourself, how are you opening up, and how you're comforting the patient. Okay, you can say it's up to you guys. Hi, Miss Suzanne, I'm Dr. Imran here. How may I help you today? Okay, what brings you today? Okay, is there anything I can help you? So this kind of things you have to use rather than using the uniform sentences, which is making many candidates to lose their marks because there is a research going on. There is some sort of thing doing. We call it plagiarism in our language. This plagiarism always make it suspicious to the candidates because they are following some certain sort of standards. Okay. And these standards not they don't like these standards. Even though MRCGP UK also they don't like the standard. This is the candidate must use their own words rather than following some sort of copy pasted items. So please make sure follow your international standard. Follow international standards means like say your own language, doctor. The reason because it will break it will bring more chances and will brighten your chances to pass the station. Okay. It is the same thing what we do in daily life that to see the patient, we are treating the patient and patients are getting better. They also know that we are a competent doctor, but they wanted to follow some international standard whether we are following or not. Okay, though it is for the short time for the 14th station, we are preparing ourselves for 6 months or over 6 months. Some people are over the 1 year because they didn't got the seats in 1 year. So they were going through. But doesn't mean that you have to copy paste the things. Please make your own standards. There is no such thing written that I have to follow that protocol only. Okay, please reference this thing. Second thing, if you are asking eyes after HOPI, pretty fine. Okay, there are many platforms I can show you that whereas you can see no one is asking ICE about after psychosocial. No one is asking except one or two platforms. Even in orientation program in Abu Dhabi, they also they discourage this thing. They categorically told us that don't follow that uniform things because they don't like copy paste because they are old school people. very old people sitting over there, they having own their forms, okay? So they wanted to see that what international guidelines says. So please take care of that one, because it was because I'm doing, so we are doing this every day basis, many candidates. So we are passing through this situation that where there is some sort of uniform things are there. Please take out that habit and make your own sentences. Opening statement, asking about the eyes, asking about anything. So you have to make your own, like say, as a character, not as a doctor, like as a character. You have to portray over that you are a unique character, which is unique than other 300 candidates which appear who are appearing in exam now. Okay, so uniformity also making the candidates, unsuccessful rate more than the other thing. Though you have everyone having knowledge, doctor, but what they are testing the uniformity, plagiarism, like say, um, uh, what you call it? There is some saying is that we are not
Pattern.
a, you are not a rat. We are not a rat actually. Like say we are going behind the big pipers. Okay, no, we are the one. We are the human. We have our own style. So you need follow your unique style, please. So that's it, doctor, from my side.
Thank you, Dr. Imran.
Thank you.
And the next case of Dr. Hafsa was hypertensive nephropathy. There we have to tell the diagnosis also. I feel like you didn't say hypertensive nephropathy, Dr. Hafsa. And then this patient was having 1 plus proteinuria. So next ACR and EGFR needs to be there so we can start on. And up till 3A, 3, 3A of the class, we can start. We can treat the patient at the primary care, but after 3B, we are going to refer to the nephrologist. So no internal medicine people are involved in here. Okay. And
Dr. Musarat,
apart from this,
I said that if EGFR less than 30, then we'll send you to nephrologist. Otherwise,
nephrologist.
yeah, otherwise it should not be treated by the internal medicine. If it is,
No, no. No,
then
it's treated by us.
we should treat them.
Yes. Up till 3A category, we can treat the patient, but after 3B, we are going to refer.
Okay.
Okay.
Yeah.
And here ACR needs, so we are waiting for the lab results for further action. Urea electrolytes, EGFR, CBC, LFTs, and also glucose lipid profile. Tell the patient about her concern was dialysis. So tell her these medications are safe for the kidney and your blood pressure needs to be controlled so you don't go on to the dialysis as you are concerned about. Okay, and CBC score you did at the end. It was fine to start the statins if needed, otherwise follow up. So this was for your cases. So next is Dr. Ashin. Dr. Ashni, are you there?
Yes, doctor.
Okay. So your first patient is Mrs. Patel, 60 years old male, came to discuss his problem with you. Please proceed with history and examination and management plan. Examination is
Okay.
gray. Okay. Your time starts
Okay.
now.
Good evening, Mr. Patel. I'm Dr. Achin, your GP today. How can I help you?
Doctor, actually, even small meals making me feel full and sick.
Okay. Can you tell me more about it, Mrs. Patel?
Yes, doctor. Actually, I'm trying to control my sugars, but somehow it's above what I'm controlling. It's not in control anymore since 6 to 9 months.
Okay. So I'm so sorry what you're going through, Mrs. Patel, right now. May I know, Mrs. Patel, since when you were diagnosed to have these high blood sugar levels?
Doctor says 25. I was 25 years.
Okay. So, Mrs. Patel, may I know that what are the drugs you are on?
I'm taking insulin for that.
Insulin. Okay. So you told me that you feel that your heart sugar levels are not on the correct levels for about 6 to 9 months. So do you feel more thirsty these days?
Yes, doctor, but I feel early satiety and nausea, and sometimes I get vomiting also of undigested food.
Mm-hmm. Okay. Okay, Mrs. Patel. So other than that, do you have any chest pain?
No, doctor.
Any numbness or weakness of your one side of your body?
No, doctor.
Okay. Any numbness in your feet?
No, doctor.
Any wounds?
Yes, doctor, I feel numbness in my feet.
Mm-hmm. Okay. So, Mrs. Patel, other than the high blood sugar levels, what are the other illnesses you are suffering from?
No, only this one illness.
Mm-hmm. Okay. So, other than insulin, are you on any other medications?
No, doctor.
Okay. So, Mrs. Patel, may I know that what is your idea about this?
Doctor, I think my stomach is not emptying properly.
Mm-hmm. Okay. What is your main worry with that, Mrs. Patel?
Doctor, I'm concerned about any complications or my sugar levels
Mm-hmm.
not getting low.
Mm-hmm. Okay. So what do you expect from me now, Mrs. Patel?
That doctor, I want some test and treatment to help this nausea and digestion better.
Yeah, sure. We will discuss about that, Mrs. Patel. May I know that in your family, anyone else suffering from any long-term illnesses?
Yes, doctor, my sister also having the similar type 1 diabetes problem.
Uh-huh. Okay. Other than that, any other high blood sugar levels, high blood pressure levels, high blood pressure,
No, doctor.
any high lipids?
No, doctor.
Okay, Mrs. Patel, may I know that what do you do for living?
Doctor, I work as an IT specialist. I
Mm-hmm.
used to work.
Is
I'm
it
retired now.
okay? So with whom are you living at home, Mrs. Patel?
With my husband.
Okay. So do you have diet control with this high blood sugar levels? How is your diet?
Doctor, I cannot eat a lot of things. Whatever I'm
Mm-hmm.
eating, I take
Okay.
sugary foods also sometimes.
Mm-hmm. Okay. Okay. Do you exercise?
No.
Are you smoking, Mrs. Patel?
Yes, doctor.
May I know how much?
10 cigarettes a day for 10 years now.
So, Mrs. Patel, I think you are aware of the hazards of smoking. Is that okay if I arrange another session to think about, if you think about quitting smoking? We will arrange another session. Is that okay?
Sure, doctor.
Any alcohol consumption?
No, doctor.
Okay. So, Mrs. Patel, may I know about how this thing has impacted your life?
Doctor, actually, I cannot eat properly. Every time I'm having
Mm-hmm.
nausea, sometimes vomiting. I cannot, and I feel like I'm losing weight.
Mm-hmm. Okay. Mr. Patel, may I know that what is your weight according to height?
21.
Okay. Mr. Patel, may I know that how do you use these insulins?
Doctor, I'm using it on the same site for 25 years now, more than 25 years, morning and evening.
Okay. So, are you taking, how is the compliance with that? Are you taking it daily?
Yes, doctor, but sometimes in the evening I take less amount, like only 10 units, because I feel like I will get low sugars
Mm-hmm.
in sleep.
Okay. So, did you had any experience with low blood sugar levels?
No, doctor.
Okay, Mrs. Patel, may I know that where do you keep this insulin?
Sorry?
Where do you keep insulin, Mrs. Patel?
in the fridge.
Okay. Okay, so Mrs. Patel, so you let's sum up. So you came with this. You are not a patient with type 1 diabetes, and we on insulin for about 25 years, and you feel that you have these features of indigestion in taking food and loss of appetite and early satiety for about 1 year now, and you are thinking about some tummy problem with diabetes, and you want me to give some management plan. Is this okay? Is this all, or you want me to add anything else?
No, doctor, that's all.
Okay, so Mrs. Patel, I want to do a quick examination with you. Is that okay?
Sure, doctor.
Yeah, so can you please come to the couch? I want to see your BMI is known and blood pressure, your pulse rate, your respiratory rate and saturation. I'm going to see whether you are pale, ecteric, and how is the dental caries, how is the hydration level right now. And I want to see your neck for any lymph node enlargement, and I want to see the insulin injecting site of you. And also I want, may I see your tummy? I want to inspect, palpate, and auscultate the tummy, and also I want to do the diabetic foot examination with you, and I want to do the urine nitrate, protein, and sugar levels right now. Is that okay with you?
Okay. Yes,
Yeah.
mild epigastric discomfort, no mass, generally thin patient, otherwise normal.
Yeah. So Mrs.
Peripheral
Patel.
neuropathy also present.
Yeah. Okay, so Mrs. Patel, what I gathered from the information you said and the examination finding, it seems that as you are suffering from high blood sugar levels, so now you have this one of the complications of that, which is called as diabetic enteropathy. Okay, Mrs. Patel. So don't worry about the medical jargon. So as and other things I noticed from you is that you are taking this insulin to the same side of your hand, and there are you have the features of diabetic neuropathy also. So shall we discuss about the management plan, Mrs. Patel, with you?
Yes, doctor.
So, as you are aware about the complications of the high blood sugar levels, I will give you the leaflet about how does this diabetic enteropathy is happening, and what we can do is, what you can do is, it is if possible, please take small diets and small frequent diets in regularly, but make sure that you are not taking high sugar diets and drugs with high carbohydrate levels, and please make sure that you are taking high fruit and vegetables. And other than that, how about starting some antacids with you? Is that okay if I start some omeprazole with you to control some of the manage some of the symptoms you are having? Is that okay with you?
Okay, doctor.
So other
Thumbs up.
than that, I would. Okay, if you're having worsening of symptoms, please come back to me immediately.
Okay. Thank you, doctor.
Thank you.
Okay, so your next case, 1 minute. Your next case is Mr. Hakim, 24 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Okay. Good evening, Mr. Hakim. I'm Dr. Achini, your GP today. How can I help you?
Doctor, actually, my throat is really killing me, and I can hardly swallow.
Okay. Can you tell me more about it, Mr. Hakim?
Doctor, it's been going on for 4 to 5 days now. I was having a bad sore throat and fever, and felt like it's some kind of tonsillitis. But doctor,
Mm-hmm.
since 2 days, it has gotten so much worse on the right side.
Okay. Mr. Hakim, I'm sorry what you're going through right now. Are you comfortable right now, or do you want to lie down on the couch?
No, doctor, I'm comfortable sitting.
Okay. So, Mr. Hakim, may I know that are you still having this fever?
Yes, doctor.
Okay. Did you measure it?
No, doctor, but I really feel high grade in fever.
Okay. So you have difficulty in swallowing also. Are you able to take fluids?
Doctor, I am trying to, but I cannot swallow solids and struggles with the liquid now also. Sometimes it's rolling into tissue.
Mm-hmm, okay. So, Mr. Hakim, may I know that did you notice any lumps in your neck?
No, doctor.
Okay. So do you have any rashes in your body?
No, doctor.
Mr. Hakim, may I know that are you treated with any antibiotics or any medications for this?
Doctor, I was just taking on my own. I was taking paracetamol, brufen, but it didn't
Mm-hmm.
relieve me a lot.
Okay. So, Mr. Hakim, may I know that now do you have any breathing difficulty?
No, doctor.
Okay. Other than that, do you feel any problem with passing urine?
No, doctor.
Any chest pain?
No, doctor.
Any joint pains?
No, doctor. And doctor, yes,
Okay.
I am having just a little bit of urine and it's dark urine because I couldn't sip a lot of water.
Okay, yeah, I can understand. So, Mr. Hakim, may I know that are you suffering from any long-term illnesses?
No, doctor.
Are you on any medications other than this paracetamol, brufen, and those things?
No, doctor.
Okay, Mr. Hakim, may I know that what is your idea about this?
Doctor, I feel it's some kind of worsened tonsillitis.
Mm-hmm, okay. So, what is your main worry with that?
Doctor, I'm afraid that my throat will close completely and it might choke me. And my voice is changed also, doctor.
Mm-hmm, okay. Okay, I can understand, Mr. Hakim. Other than that, in your family, does anyone had similar kind of illness?
No, doctor.
Okay. Any other long-term illnesses running in your family?
No, doctor.
Okay, Mr. Hakim, what do you expect from me?
Doctor, I just want any medication.
Yeah, sure. So, Mr. Hakim, may I know that what you do for living?
I am a bank manager.
Okay. Is everything okay with your job?
No, doctor. Since yesterday I didn't go to job and I'm hardly
Yeah,
eating
okay.
and drinking water
Yeah, I can understand. So, Mr. Hakim, may I know that with whom are you living at home?
with my wife.
Is everything okay at home?
Yes, doctor.
May I know about your smoking, Mr. Hakim?
No, doctor, I don't smoke.
Any alcohol consumption?
No, doctor.
Okay, so I understand your diet is very poor with these days with this problem. Other than that, in general, are you taking healthy diet?
Yes, doctor, I'm trying to take healthy diet.
Are you aware of your height, weight according to the height?
23.
Okay. Mr. Hakim, may I know that do you do exercise?
No, doctor.
Okay. So, Mr. Hakim, you came with this severe throat pain and fever for about 5 days now, and it is worsening in one side, and rolling of saliva is also there, and you are unable to take anything from mouth, and you expect me to give some medicines as you're worried of worsening of your tonsillitis. Is it all, or do you want me to add anything else?
No, doctor, that's all.
Okay, Mr. Hakim, is that okay if I do a quick examination with you?
Yes, doctor.
Please come to the couch, Mr. Hakim. I want to see your blood pressure, your pulse rate, your temperature, respiratory rate, and also I want to see whether you are pale and any icterus. And can you please open your mouth? I want to see the inside of your mouth. Say, put your tongue out. I want to see your tonsillar area. I want to see, other than that, how is the hydration level on your mouth? Thank you, Mr. Hakim. Then I want to see whether there is any cervical lymphadenopathy, and I want to see whether there are any rashes in your body, and also I'm going to see your tummy for any pain and any organomegaly like splenomegaly, and I want to see whether there is any edema. Thank you, Mr. Hakim. Um, and
Okay, one.
yes.
Okay, so Dr. Ashmi, patient is drooling, spitting saliva, having hot potato muffled voice, temperature 38.7, heart rate 104, and I'll pause the timer, sending the picture in the of throat, and tender, enlarged right upper cervical lymph nodes.
Okay.
Okay, time
Okay,
starts again.
thank you. Yeah. So, Mr. Hakim, considering what I gathered from your history and the examination finding, it seems that you're right, that you have a worsening of this tonsillitis, and currently you have this condition called peritonsillar abscess, Mr. Hakim. Are you aware of that, Mr. Hakim?
Yes, doctor, what is it?
Yeah, so it is a worsening of these symptoms of tonsillitis, and you have this collection of some infected material in one side of your throat, Mr. Hakim. That's why you are having this severe pain and high fever, and you have difficulty in swallowing all those things. And also, I noted that you have this lymph node enlargement also with that. Mr. Hakim, what we can do right now is I will give you paracetamol right now. I will check whether when you got your last paracetamol dose, and it is important that you get admit today itself to the hospital, Mr. Hakim. Are you okay with that?
Okay, doctor.
Yeah, because Mr. Hakim, we need to give some antibiotics to you, and you need to do some investigations like full blood count, CRP, ESR, and also it is important that you have that rolling of saliva. It is important to do some intervention with this abscess, Mr. Hakim. You got my point?
Doctor, what will they do in with the abscess?
Yes, so it is important to drain the abscess, Mr. Hakim, and to
Mm,
take the slough out. Okay.
okay,
So, other
okay,
than
doctor.
if it is the treatment method what we could do for this type of illness, Mr. Hakim, because other than that, if the antibiotics will not be help to improve this infection, this type of infections. So, as you have this poor oral intake and your high temperature, you have tachycardia with that, and seems like you're having some hydration problem, and it is important to give some IV fluids with you. Is that okay if I insert the IV line and connect to the IV fluids while informing the ambulance to come to here?
Okay, okay,
So
doctor.
I will inform your family members also. Do you are they here with you?
No, doctor. Time
Okay, give
starts.
me now my number. I will give phone number. I will contact them and inform you. And please come back after discharging from the hospital. Is that okay?
Okay, doctor.
Okay, thank you.
Thank you, doctor. Okay, so Dr. Ashni, your first case was um, 1 minute.
Diabetic
Yeah, diabetic. It was the
gastropathy.
diabetic one and diabetic gastroparesis. So mostly patients will come like
Gastroparesis.
this, having early satiety, vomiting, nausea, and like that because their sugar levels are high also and already developed neuropathy. So here we need to check nephropathy along with the retinopathies. So you asked about
Mm.
the blood in urine and any blurry of the vision, any chest pain, it was fine. In this case, I don't have to add a lot, but you can start on the medication like PPI or omeprazole and
Mm.
continue with the small meals and keep checking their blood sugar levels and tell him to continue his insulin and make a blood glucose chart for 1 week and review.
Mm.
Okay.
Mhm.
And tell him that
Okay.
it is because of the diabetes and since he's taking sugary foods also, Try to quit
Mm-hmm.
small frequent meals, low fat diet, low fiber that is easy to digest, and avoid any large or heavy meals. Okay.
Mm-hmm.
And
Yeah.
prokinetic agents can be given like short course of metoclopramide or domperidone in this case.
Mm-hmm.
Okay. Referral is not needed until unless the patient is really needing nutritional support or losing a lot of weight. You didn't ask for weight loss in this case. Important to
Yes.
ask for weight
Uh-huh.
loss in any chronic condition. Okay, so 3 kg
Yeah.
was lost.
Mm.
Apart from this, Dr. Imran, do you want to add something?
No, doctor, that's it, doctor. You are, first of all, you are managing the time. That is important. Second thing, you are patient-centered, but I will just suggest continue the same pace because shorter the sentences, more easier the job. Okay, if you use longer sentences to cover up the things and you're going to realize the examiner that you know more than consultant doctor, they don't like such thing. Okay, the way you guys are
Mm-hmm.
keeping, just keep it up. Okay, no need to go into detail because examiner don't want detail. They want that up to mark things. Okay, within 10 minutes we have to finish it up. So try to concise, try to shorten your sentences. That's important.
Mm-hmm. Okay.
Yes. And next case was Dr. Ashni. You really did well in the Quincy case. You almost did everything that was required, but just ask about the pain score. Where is the, do you have pain on the right side? Is it going anywhere? It was radiating to his right ear, and also Christmas was positive and changing in the
Mm-hmm.
voice. Okay, they might be
Mm-hmm.
having a changing in voice when they talk over there. Otherwise, red flags were airway, any obstruction or
Mm-hmm.
dehydration, and nil per mouth is important in this case, and telling the
Oh.
patient about draining the abscess is very important. And they might start on IV antibiotics, and you started the IV line. And one thing was missing, chaperone and privacy. We need to
Yeah, okay.
say it like in the presence of complete privacy and chaperone we start. Otherwise, you are going to refer this to patient to either emergency or ENT setup.
Mm-hmm.
Okay. Thank you, doctor.
Okay.
Now, Dr.
Thank you.
Imran, it's up to. Thank you.
Yeah, Dr. Kamlesh, you're ready. Doctor, can you tell me which title you kept these cases?
Yes.
Your topmost title.
My topmost title, let me have a look. That new AF,
Yes. No, no, no. I'm sending the one.
tell me. Dr. Kamlesh, all the best. When is your exam, Dr. Kamlesh?
1 second, doctor.
I was like, Ken. All the best, my boy.
Thank you, doctor. After this session, I have to talk to you maybe personally. I
Yeah,
will
yeah.
talk with you.
Sorry, actually, Dr. Kamlesh, I am really sorry for that. Other day I was in
No,
meeting
no,
and
I can understand. We can. Means I'm telling after this, I will have to talk to. I need
yeah,
your
yeah,
help.
sure, sure.
Maybe.
I saw you call on that.
Yeah, sure, doctor. Thank you. Thank you.
Okay, doctor. Give me 1 second, doctor. I have to look. Give me 1 second. So, Quincy is one of the favorite case of mine. I like that case because many of us we do overlook such cases as a tonsillitis and something we do have. Okay, this is newly diagnosed. Okay, doctor. So, Dr. Kamlesh, doctor, I have to keep the timer, or who is keeping timer?
I'll keep the timer on.
Okay, okay, thank you.
So,
Give me 1 second. I have to look into the scenarios. Okay, doctor.
Okay.
So, Dr. Kamlesh, your patient is Mr. Khalid,
Okay.
35 years old. Come to discuss
Sorry.
his problem
How
with
much,
you.
sir? Sorry, age?
35,
Age, sir?
35.
35. Okay.
Came to
Mm-hmm.
discuss his problem with you. Take proper history and manage the patient. Examination is gray. Huh?
Yeah.
Your time starts now.
Okay. Good day, Mr. Khalid. My name is Dr. Kumar. How may I help you today?
Doctor, I don't know what to say, doctor.
Mr. Khalid, I am understanding your worry. So I can assure you one thing that whatever you will talk with me in today's consultation will be remain confidential. So if you are feeling anything, feel free to tell me.
Doctor, I am having the problem with my relationship, doctor.
Mm-hmm.
It's really in
So
hard water, doctor. Can you help me, please?
don't worry about. I am here to help you out as much as I can do. So Mr. Khalid, can you tell me something more about your relation problem?
Doctor, I'm not, my wife is not happy.
Mm-hmm. So, Mr. Khalid, is there anything else to say, or if I can ask you some questions more?
Sure, doctor, what you want to ask?
Okay, so Mr. Khalid, you told me that you have problem with relations, maintaining relations. So,
Yes.
is it okay? Can you tell me exactly since how long you are feeling like that?
Doctor, it's been a couple of months, like say maybe 6 months, doctor.
Mm-hmm.
And
6 months. Mm-hmm.
gradually I have felt that I don't have, I don't have, much, erections, doctor.
Okay, so Mr. Khalid, I can understand, and your concerns are valid. So, can you just tell me that whether it all comes suddenly or it comes in, means gradually all the
Doctor, I feel this is 6 months. I'm feeling this I can't make it,
Mm-hmm.
properly, doctor. It's really
Okay.
embarrassing for me, doctor.
Yes, Mr. Khalid, don't worry about. I will try to help you out in this regard. So, can you tell me exactly the you have problem in initiating this all or just to maintain during the relations?
Doctor, I'm having difficulty in achieving and I can't maintain it, doctor.
Mm-hmm. Is
And
this all? Mhm.
I feel that, doctor, I can't, I don't have libido, doctor.
Mm-hmm. Okay. And do you feel that it is happens every time or sometimes only?
Well, doctor, it's every time now. It's been 6 months. Gradually, I'm
Mm-hmm.
really feeling embarrassed, doctor. I don't know. I'm already
Don't worry.
a bit more depressed, doctor. Again, I will be. It is
Mm-hmm.
more problematic, doctor.
Okay, Mr. Khalid, we'll try to solve together regarding this matter. So, have you noticed that you have early morning erections?
No, doctor. Nowadays, everything is for me upside down, doctor. I can't remember, doctor.
Mm-hmm. And do you have any pain in your private area?
No, doctor.
Any injury in this area before?
No, doctor.
Do you feeling cold?
No, doctor.
Okay. Do you feel desire to have intercourse?
I reduced, doctor.
Mm-hmm. Okay. And is there any issue going on with your partner?
No, doctor. She is very supportive.
Mm-hmm. And may I ask you some private question if you don't mind?
Sure, doctor.
Do you have, apart from your partner, do you have any other partner as well?
No, doctor.
Okay. Do you have ever felt any chest pain?
No, doctor.
Any difficulty in breathing?
No, doctor.
Okay. And apart from this, do you suffer from any high sugar levels,
No, doctor.
high blood pressure,
No, doctor.
any gland problem?
No, doctor.
Are you using any type of medication over the counter or regular basis?
Well, doctor, I started some medication, doctor, because I was
Mm-hmm.
having some problem
Mm-hmm.
with my brain, depression, doctor. I was depressed because of my loss of my business.
Mm-hmm. Okay.
And they given me medicine, doctor, that
And
I'm taking.
okay, can you tell me about more about this business problem for you? Means since how long you have this problem?
Doctor, as you know that the world is going under recession, so I lost my business
Mm-hmm.
and I went into depression. Then I went to doctor and they started me on medication. I'm improving, doctor. I've really improved. I feel fine on my medication, doctor. Much more like myself, doctor.
Do you know about the name of the medication?
Doctor, it's Sertraline, doctor.
Sertraline. And since how long you are taking this Sertraline?
Last 6 months, doctor.
Last 6 months. Mm-hmm. And how much dose you are taking for that?
Doctor, it's a recommended dose given by the doctor. They say that it's a medium dose, doctor.
Mm-hmm. Okay. And what do you means what business do you do?
Doctor, I'm doing some import export, but due to this
Okay.
situation, so doctor, I
Mm-hmm.
couldn't make it, and a very
Yes,
difficult
I can
situation I'm
understand.
passing through, doctor.
Mm-hmm. Do you smoke?
Yes, doctor.
Okay. How many cigarettes?
Doctor, almost 40 cigarettes daily nowadays.
Since how long?
Doctor, I just started 6 months ago.
Mm-hmm. Okay, so how about if I provide you some literature regarding you go through it and it will tell you how much benefit you can get if you are thinking about to quit the smoking. Is it okay with you?
Okay, doctor, we can talk,
Okay.
doctor.
Okay, and do you drink alcohol?
Yes, doctor.
And how much?
Doctor, daily 3 pints.
3 pints. And do you have what type of food you like to eat?
Doctor, home food.
And do you know about your height to weight ratio?
Doctor, my weight increase. Last time it was my BMI was 26. Now it is
Mhm.
my BMI is 33.
Okay. And do you feel that you are no more interested in the things which you previously were?
No, doctor, I improve after that medication. Yeah, that medicine is really working.
That's great. That's good. So, Mr. Ahmed, what comes in your mind regarding what can be the reason behind that?
Well, doctor, it may be my depression or maybe some.
Mm-hmm.
I really don't know.
Okay, and what comes in your mind as a worry regarding this?
Doctor, if like say if it is this medicine, doctor,
Mm-hmm. And
and if
mhm,
I'm stopping, my depression will return back. I'm a
I can
bit
understand.
confused, doctor.
Mm-hmm. And what you are expecting from me in today's consultation then?
Just wanted to know, is there any alternative if like this is a medication responsible or what might be the cause, doctor?
Mm-hmm. And do you feel in any sense it is impacting on your regular life? These all
Of course,
things?
doctor, I told you, doctor, that it is really impacting. It's really embarrassing for me.
Okay, sure. So, Mr. Khalid, after having this all things in today's consultation, how about if I do for you your general physical examination as well as the examination of your private area?
Okay, doctor.
Okay, so I will do for you your, I will check your vitals like pulse in both arms, blood pressure. I will see any lump and bump in your neck. I will start this in the presence of Chevron after doing the hand sanitization. How about
Okay,
it?
doctor.
Okay.
Fine, doctor.
And is there anything in the private area?
No, doctor. Examination normal.
Okay. So after having this all things in today's consultation, most probably it seems like as you are thinking about it is maybe because of your condition, mental condition, or because of the medications. Okay. So yes, in your case, it seems like because of the medication which you are taking, sertraline, sometimes have the side effects like difficulty in erection. Are you getting me?
Okay,
Stop.
doctor.
Okay, so I will transfer you to the this
Time up.
thought doctor. Yes, sure.
Okay. Doctor, your next case, or you want me to discuss this case first because you are the last candidate?
Yeah, sure, as you wish, sir.
Okay, Dr. Kamlesh, Dr. Kamlesh. This was a case of erectile dysfunction. Patient was on SSRI. You took the proper history, but you drank a lot. Here again, past medical history, doctor. Are you suffering from this condition in past before? First, you have to catch that patient's HOPI in past medical history to get relationship between this is a first time or this is a recurrent. Am I right? So
Okay, yes.
yeah, yes, it's not something I have to ask about hypertension, diabetes. This is a doctor. The will examiner again will think about checklist. Please don't.
Oh,
Okay, always relate patient's current problem with the past means like say, do you have this kind of condition in the past or before?
past yes, sir.
Yes, and then go jump to other thing like say any other chronic illness other than this.
So, doctor,
Okay.
we have to ask this question means when the patient coming since 6 months. So, after having this all questions, I have to ask it after that regarding do you have the same condition in the past as well, or first is this first time you are feeling this 6 months? Like, what should be our goal in the
Okay,
history?
there are two patterns are there, doctor. Like
Mm-hmm.
say this patient having just 6 month or 3 month duration, there's a
Mm-hmm.
trick. The trick
Okay.
is that, Mr. Khalid, may I know, is there
Mm-hmm.
anything specifically happened in last 6 months?
Okay.
Patient will open up. So you don't
Okay.
have to waste lot of time in digging up the
Mm-hmm.
story.
Mm-hmm.
Okay, your
Mm-hmm.
one sentence will open up the lock. So
Sure.
here you can enter and you can then you can just touch that other points and come out from the scenario.
Mm-hmm.
Because here time management always happen. Why we are asking about the duration, doctor? Duration will be telling you the story about whether this is acute or chronic, or long
Mm-hmm.
duration or
Yes.
recurrent.
Mm-hmm.
Okay, first time or before it's
Before
happening.
in the past, yeah.
Yes, yes, doctor. This is a trick. So here, in this kind of cases, we have to say, Mr. Khalid, do you have any idea what is there anything special happened in last 6 months or just 6 months before? So he will be telling,
Before
doctor,
this.
I was having depression. I was on
Okay.
medication.
So no need to go for more questions and just be
Yes, exactly.
precise.
Here you will be, you can start winding up.
Winding up and go for the medicines.
Yes, doctor. Then
Yes.
you have to
Mhm.
management. So how are you going to manage the patient? You have to acknowledge and
Mhm.
validate. Okay, Mr. Khalid, as
Yes.
you say, I think that these are the side
Mhm.
effects. Yes, it is because of SSRI.
This is
Okay,
service.
now Mr. Khalid, this I'm going to think about. I'm going to address this idea, huh?
Mm-hmm.
Okay, this is the reason. Okay. It is not your
Sure.
fault, Mr. Khalid, and this is not all on your head. But important thing, shall we talk on this one, Mr. Khalid? First, start from non-pharmacological. Mr. Khalid, I have noticed that you started cigarette taking a lot, which is a lot
Mhm.
for us. 40 cigarettes daily is not justifiable amount. It's really a high amount. Mr. Khalid, what do you think if like say we quit? If you quit, then you have to talk about smoking. Then go towards patients. What you call it, this alcohol. Ask
Mhm.
about
Yes.
alcohol cessation program. You can talk little bit and come
Mhm.
up. Then after that, you turn to patients, mental health and sexual health.
Mhm.
Okay, now you have to review. You already reviewed that patient is saying that he improved and
Yes.
he's stable for the some time. What
Mhm.
is your next option? Where here you have to see as per the duration, doctor, we have to consider gradual dose reduction or switch under close monitoring. But now here happening whether GP will be doing or specialist will be doing. Doctor,
Mhm.
if patient having acute problem, so what you can do it, you can you can say that I'll be discussing with the specialist, concerned specialist or your specialist, and then we will be considering to reduce the dose and we'll be switching the dose.
Okay.
Okay, there
Because
are
I
two
was
options.
thinking to send him for the specialist if
Yes.
like.
Now, doctor, let's talk about something switching antidepressant. Okay.
Mhm. Okay.
So we have to switch to some other drug if, like, say, patient having already still markedly this patient having depression. So we have to reduce his side effect burden. So we can go with metrazepine.
SNR.
Yes.
Yes. Mhm.
For example, this
Okay.
is example, doctor. This is example, okay. But
Mhm.
sometimes some guidelines say that, so like say bupropion, bupropion. But still, here, if you take the safe line that I'll be discussing with the specialist.
Discuss with the specialist.
Yes. Okay. If patient don't have contraindication, you can think about PDE5 inhibitors, sildenafil for short time,
Mhm. Mhm.
with continuation of SSRI. Now,
Mhm.
what you will do before starting the sildenafil, Mr. Khalid? May I know, are you, is it at any point you have used anything for your under the tongue, simple language?
For nitrate, like anything.
Yes. Okay. For significant cardiac disease or any other
Mhm.
contraindication before prescribing PDE5.
Mhm.
Now let's talk about Mr. Khalid about psychological factors. Here
Mhm.
you have to address patients' residual anxiety and depression and relationship dynamics. Mr. Khalid, I can understand, as you say that your wife is very supportive. I can understand that she will be helping you. But if, like, say, if you feel, if you permit us, then we like to invite your wife with you in next consultation. Is that okay for you, Mr. Khalid? This is what
Excellent.
examiner want to listen from you. But if you say that I will talk to your wife, it means you are not taking the consent and you're going to open up everything to patient's wife.
No, no, obviously we will have to convince them to bring your partner.
Yes, exactly. So we have to take the patient consent, and after that you have to talk about patient wife. Now, this is pretty simple management. Mr. Khalid, is there any questions and queries so far? No, doctor. Then if he said no, doctor, then you jump to the safety netting. Mr. Khalid, I can understand that you're passing through at that time. So in case if your depression is getting worsened or with any medication changes, if like so you have done with medication, so then you have to come back to us and I will be reviewing you within 2 weeks. Okay. So you have to plan for a quick review.
Okay.
So what examiner wanted to listen from this scenario, you are whether you
Mhm.
are identifying the temporal link between SSRI and ED or not.
Mhm.
Okay, whether you are able to explain SSRI or sexual dysfunction in simple and validating terms or not. Okay,
Mhm.
you're going to weigh patient mental stability versus side effects, and you're going to discuss the dosage reduction and switching or adding PDE5 after ruling out contraindication. Okay,
Mhm.
and then you're going to offer psychological or relationship support and mood monitoring and safety netting. Doctor, this is very simple, pretty simple idea. But
Mhm.
why we are taking on our head this kind of topics? Because these are the least discussed topics are there. Due to certain reasons,
Yes.
these are the least discussed topic. Okay,
Mhm.
but
Yes.
important part here there will be some sort of agenda. Mostly the agenda comes in this kind of cases, ED, with two things, either psychological or drug induced.
Yes.
Psychological doctor, they having though two or three favorite scenarios are there. One scenario always they keep the newlyweds, they are newlywed couple,
Mhm.
okay, arranged marriage, and he is having relationship with the secretary,
Mhm.
okay, or in office or anywhere. Third scenario, doctor, here they are going to introduce or they will be introducing um, that patient is having same sex relationship. Good night.
Mhm.
Okay, so that third scenario, doctor, always will be complex. Complex in a way that patient having post-MI depression, okay, and he don't have
Yes.
anything, but he's taking beta blockers.
Mhm.
Okay, so very simple issue, doctor. You have to see the duration of the patient illness or patient's problem. Here, it will
Mhm.
open up everything.
Yes.
Okay, so this is for the AD. So let's go to the next scenario, doctor.
Sure.
So, doctor, your next scenario is 42 years old, Mr. Khalid again.
Okay.
He come to discuss his problem is to take proper history, examination, and management, huh?
Time starts now.
Good day, Mr. Khalid. How may I help you today?
Doctor, I'm having this dull ache in my legs, doctor, and I pee all the time, doctor.
I can understand it's very, very difficult for you. Mr. Khalid, can you tell me something more about your problem?
Doctor, I tested many time my urine, everything become normal. I'm really tired of this one, doctor. It's been now 6 months, doctor. I am having this my pain around my down area and my below my belly button, and
Mm-hmm.
I'm having low back pain, doctor. I have
Low
to
back.
go to toilet very frequently, doctor. I feel that urgency to go. I go there. I feel that weak stream. I feel that something is gone wrong. I tested many times, doctor. Went to doctors. They said everything is fine. But still, doctor, I feel that something is wrong with me.
Mm-hmm. Okay, sure, Mr. Khalid. Is it okay if I ask you a few questions about your condition to understand better?
Sure, doctor.
So, Mr. Khalid, you told it start from like 6 months, but how it all started? Suddenly or gradually?
Well, doctor, I don't know. But one day I was sitting on my chair and I feel that some sort of sensation. I rushed to the toilet.
Mm-hmm.
I pee, but after that, this started and it's keep on going on.
Mm-hmm. So, what do you exactly feel like? You have to pee again and again? Like,
Of course, doctor, I feel again and again frequency is increased and urgency
Mhm.
increased.
And have you noticed that once you are coming back from passing the pee, that you have still not completely evacuate or complete?
Of course, doctor, of course.
And have you noticed sometimes that your urine is leaking?
No, doctor.
Okay. And is this symptoms is every time or a specific time of the day?
It's almost every time.
Okay. Have you feel any pain while passing the urine?
Uh, Not while passing urine, but while intimacy, I feel during ejaculation.
Okay. And have you noticed any color change of the urine?
No, doctor. My urine color is white.
Mm-hmm. And have you noticed in this all time sometimes fever coming and going?
No, doctor.
Any loss of weight?
No, doctor.
Okay. And specifically, can you tell me or show me exactly which area you are feeling discomfort or pain?
Doctor, just below my belly button, down my poop area and my back area.
Back area. So back area pain is having something to relieve or anything which relieves this pain.
No, doctor, just when I'm taking some paracetamol, I feel much
Mhm.
better, and after that, again, it happened.
Okay, and have you noticed anything is making it worse, the pain?
Doctor, as I told you, doctor, if I'm just late for the toilet, I
Mhm.
get this kind of problem.
Okay. Have you noticed any eye problem in between that time?
No, doctor.
Okay. Are you suffering from any high blood pressure,
No, doctor.
any high sugar levels?
No, doctor.
Okay. Are you taking any type of medication apart from this paracetamol occasionally?
No, doctor.
Okay. And what do you do for a living, Mr. Khala?
Well, doctor, I'm a teacher.
Okay. And with whom do you live?
I'm living with my wife and children.
Okay. Do you smoke?
Yes, doctor. Occasionally.
Mm-hmm. Since how long?
It's been, doctor, 10 years, doctor.
Okay. Means any idea if you are taking how much cigarettes like?
Doctor, I'm taking almost 2 to 3 cigarettes daily.
Okay, so Mr. Khalid, actually, the cigarette smoking has their own side effects. So I will provide you the literature. You go through it, and if you feel to discuss about quitting, we can fix another appointment. Is it okay?
Okay, doctor.
Okay. Do you drink alcohol?
No, doctor.
Okay. So, Mr. Khalid, what comes in your mind regarding your urine problem?
Doctor, I was reading on Google. It says
Mm-hmm.
that maybe I have some sort of prostate problem.
Mm-hmm. Okay. And do you have any specific worry about your symptoms?
Doctor, I'm just worried about it is impacting my life, doctor, for family life and fertility
Mm-hmm.
might be impacted because of this.
Okay. And what you are expecting from me in today's consultation?
Doctor, I hope so that you will be explaining me properly that what's going on with me.
Okay. And do you feel in any ways it is impacting on your regular life?
Of course, doctor.
Mm-hmm. Okay, so Mr. Khalid, to have a better knowledge or to understand better about your condition, how about if I do for you in the presence of Chevron, I can do for you physical examination as well as the examination of your private area, and I will finish the examination by doing the your back passage PR examination.
Okay, doctor. So examination shows that a mild suprapubic tenderness, external
Okay.
genitalia normal, DRE prostate shows slightly tender but not enlarged or hard, no nodules, no spinal or neurological deficits.
Okay. So, Mr. Khalid, is it okay if I write for you a few blood tests, if you don't mind?
Okay, doctor.
I will do for you CPC, CRP, ESR. Also, I will do for you your PSA level. Okay.
Okay, okay.
And is there anything in that?
Doctor, urine dipstick shows normal, everything
Mhm.
normal.
Okay. And prostate specific antigen is okay?
Pending, doctor.
Pending. Okay, so okay, and do you have any? I forgot to ask you one question, if you don't mind. Do you have any problem in stool passing?
No, doctor.
Okay, so most probably after having this all things in today's consultation, I will wait for the results of your prostate specific antigen. But most probably, it looks like you are suffering from a condition we called it chronic prostatitis. Do you know about it?
Yes, doctor, I had in past 2 years ago.
Mm-hmm. Okay, so what is your understanding about this prostate problem?
Doctor, I think, doctor, this is prostate again inflamed, doctor, maybe.
Mm-hmm. So you suffered in the past as well, right?
Yes, doctor.
When around 2 years back.
Yes, doctor.
Okay, do you know what doctor told you exactly? What is the problem with your prostate?
He said that I have some problem like, with my gland.
Okay. Mm-hmm. So, Mr. Khalid, after your results, we will see about, and if we need, I may refer you for the scan of your prostate. So it all depends. So first of all, I am just waiting for that, and it seems like that the your prostate is getting a little infected again, same like before. Okay, but till
Okay,
now
doctor.
there's no any red flag sign. We call means there's not a dangerous sign showing in your case, as your weight is okay and there's no any change in the color of your urine and you're not
Mm-hmm.
losing weight, so it seems right. So once I will go through the results, I may refer you to the urine specialist doctor. There he may do the ultrasound of your prostate as well. Okay,
Mm.
and we will see about the future plan of your treatment. How about it?
Sounds good, doctor.
Okay, and in the meantime, I will suggest you. So just try to decrease the fluid intake. Okay,
Mm-hmm.
and
Mm-hmm.
don't try to stop the urine. Whenever you
Okay,
feel, you
doctor.
just go and try
Time is
to
up.
take some time to
I
pass
know,
it.
doctor.
Yes. Okay. Mhm.
Okay, Dr. Kamlesh. Let's postmortem. Okay, overall your history was up to mark. Doctor,
Mhm.
again, I twisted this case for you because
Mhm.
in the past history, you missed the boat.
Yeah,
If you
same like
are,
before.
yes,
Yeah.
if would have asked that one,
I
you
am
might have
feeling
catched the
now
boat.
this question, this is first time is like will save your time so much. So this I will have to practice more. Mhm.
Okay, so you missed the boat since the past history,
Mhm.
and though the patient was keep on telling that his all reports are normal, normal, so you might
Mhm.
think about some other disorder like the psychogenic disorders, but
Mhm.
this patient had the problem is acute this, chronic prostatitis, or
Mhm.
we can call it chronic pelvic pain syndrome because patient had
Mhm.
multiple area problems. Okay, suprapelvic and back, and even though he was complaining pain behind between my legs. Am I right?
Mhm. Yes.
Examination doctor, since you done the DRE, you are going to say that you should not say that I will be doing PSA.
Yeah, after 48 hours.
No, here if you say that after 48 hours or so, you will not be saying anything about it. But you
Uh,
miss one thing, doctor, you have to
After
say that
day.
I will be doing sex STI screening.
Yes.
Okay.
Yes.
And
Mhm.
treatment, doctor, pain management. This is an NSAID or other analgesic you can give. If, like, say, patient already taking the medication, what will be the other choice? We call it neuropathic pain reliever, like say, gabapentin or whatever, so on. Okay.
Gabapentin.
Okay. And trial of antibiotic you can give empirically, doctor, if you're thinking some sort of, bacterial element is there.
Mhm.
And we have to avoid for prolonged and repeated courses without any clear benefit. One. Number
Mhm.
two, doctor, if you're not saying antibiotic, not a problem. You have to think
Mhm.
about alpha blockers, okay, and the
Okay.
pelvic floor physiotherapy and lifestyle management, doctor. Here, lifestyle what? This is a very tricky question, but very simple
Mhm.
answer that you have to avoid bladder irritant, like say coffee, alcohol, spicy food.
Caffeinated ginseng.
Okay, and warm baths to help the pain. Okay, and psychosocial support. Okay, patient having chronic pelvic pain. Okay, so we
Yes.
have to send for we have to screen for anxiety and depression, and we offer counseling for the pain and clinic and referral if like say you need, and refer
Mhm.
to the urology. That's the important part. What examiner wanted to know from this thing? Examiner wanted to know that whether you are able to illustrate the pelvic pain and lower urinary tract syndrome sorry, the symptoms or negative infection workup because key patient was
Mhm.
keep on saying that everything is normal and you're going to exclude the red flags.
Yes.
Okay, malignancy
Mhm.
like say hematuria, weight loss, or hard
Weight loss
prostate.
and
So you
fever.
did. Okay,
Mhm.
explaining the patient about chronic prostatitis and chronic pelvic pain syndrome. A
Mhm.
patient, since this patient had chronic issues, and you're going to offer multimodal management like say analgesia, alpha blocker, and a possible short antibiotic trial if like say you feel and pelvic floor physio, lifestyle
Physio.
changes. Yes, and you're going to screen for psychosocial impact because this kind of patient always we have to rule out psychosocial impact. Okay,
So
and
we
we
should
you
go
are
for this two questions first.
yes, doctor.
Mhm. Okay. Sure, doctor.
So yeah, yes, that's it, doctor, from our side.
Mhm.
And any questions, any queries, most welcome, doctor.
Thank you, doctor. Actually, I am thinking about if we ask first, that is this the first time we'll save our time.
Yes, doctor.
Mhm.
Simple tricks are there, doctor. Report
Mhm.
patient, ask ICE earlier. Female patient, ask LMP earlier. Okay. And moreover, patient having chronic or acute, based on that one, ask patient past history. Important thing is that if you think about simple, shortened things, it will make your life easier rather than doctor jumping and asking so many questions, doctor. Even examiner
Mhm.
also get tired and he get bored.
Mhm. So I think now trend is changed that go for that to make more easier questions in the start so that you can
No,
save
doctor,
you.
it's been there since beginning, okay. But only the
Mhm.
thing we need to practice more, no?
Mhm.
Yeah, this is
To
based on
make it
practice.
habit to ask, is this the first time
Yeah,
we are feeling
exactly,
like that?
exactly. And since
Mhm.
you are working in UAE, doctor, so
Mhm.
you are more trained than the those working in South Asia.
Yeah, actually, so sometimes actually I discuss with my wife. The problem is I was working with this local for last 11 years for the primary health center. So first of all, the problem is with my English. So, so this is the main
Yeah,
problem. So
Doctor,
if it is in the Arabic, I can.
Dr. Hafsa can tell you the story.
yes,
Yeah, yeah.
Dr. Imran, really, this is what Dr. Kamlesh said, that these are all local Arabic.
I think
So this is, we are,
Doctor. Yes,
yeah,
yes. Same
I,
like you, Doctor Afsar.
yeah, yeah,
So,
yeah,
I tell my wife if I have to finish it, حبيبي كيف الطال هنا في زين شو
Doctor,
مشكلة هذا كم في قبل كيف
Doctor,
هذا within 10
sorry, I
minutes
don't,
you
Dr.
can do
Kamlesh, I don't
it.
understand much Arabic.
So actually, doctor,
Uh,
what happens? So you know
no,
the same thing in Arabic. Okay, क्या हाल है? आ जाओ बैठो. Or what happened to you? Is this first time? Like you can do the same case in Arabic maybe in 5-6 minutes.
Dr.
okay.
Imran, this is the thing that we are
This is the
really.
problem for me right now.
So, Dr. Imran, for me, it's really difficult the English. I don't know
Hmm.
how can I do it
Actually,
in the
when I
exam,
came
because
in
exam it
Emirat,
is only,
yeah,
exam is only just 2 days, after 2 days.
No,
So
no worry,
yeah.
doctors. First of all, let me tell you,
Mm.
language is not a problem. Actions and how you're following the protocol, that is the
yes,
important
sure,
part. Okay.
sure.
Here, no such thing. This is not such thing about the exam, about the language. It's based on your actions, empathy. How you are interacting
Yes.
with the patient, how gently you are seeing the patient, how gently you are. You see, if you are looking at the patient and just looking at the patient and nodding your hand is a positive gesture rather than turning your head and keep on writing on the pad.
Mm-hmm.
Okay,
Right.
so nodding head, no, this is clearly it is written in their curriculum that if you are nodding the head, you're nodding and I can understand Mr. Khalid. Yes, Mrs. Khan, I can understand your what you're saying. This is a simple thing they wanted to see. That means so I'm all over to you, Dr. Mrs. Khalid, that whatever you're saying, I'm listening you.
Mm-hmm.
Okay,
Yes.
so it's not, but the thing important, doctor, first of all, make your own thing. Okay, please, because this is what new things, and we are advanced in MRCGP, not other than in 2020. MRCGP was pretty simple, pretty simple. They were calling on now first one day before exam. Also, you can go and you can say I wanted to give OSCE. They will be they used to say call you, okay, come and give the OSCE. Here now, if you're thinking about the seat also, you need within 2 minutes you have to fill up your application. Otherwise, you will be out.
Yeah, yes. Bulk of students.
Yeah, because there is a 1,300 to more than 1,400 doctor backlog is there. What do you think? It's not that simple, but anyhow, all the best for you guys. If you got the seat,
Thank
so you will
you,
be passing,
doctor.
inshallah. So there's no such thing, and trust on yourself, Dr. Kamlesh. So you'll be calling me, no?
Yeah, yeah, sure, doctor.
Okay. Okay. Thank you very much,
Thank
doctors.
you for your time, doctor.
Again, good
Thank you.
night.
Thank you.
Thank you. Thank you.
Thank you, doctors.